Hello, I'm Audrey Elliott, and I'm going to be talking about eating disorders among adolescents and young adults. So the problem in general is that eating disorders are prevalent among youth, they're prevalent among men, and they're prevalent among women. It's the 12th leading cause of physical and mental health related disability-adjusted life years, so basically the number of years lost in life due to a disease. Weight-related bullying is another factor that's associated with body dissatisfaction and eating disorders among younger adults. And one factor that I found shocking was that adolescent onset leads to lower education attainment. So it's not just a health issue, it's a social issue. And one other thing that's important is that there's a high rate of health service access by individuals who have eating disorders, but a low rate of targeted treatment access specifically for eating disorders. And as I'm sure you know, there are a lot of negative externalities associated with non-treatment, such as risk for the individual and negative impacts on family and friends. So the specific policy I'm going to be looking at is train the trainer policies, and the way it came about is that healthcare providers, teachers, and peers realized that they were unable to detect signs of eating disorders. So even though the risks and costs of eating disorders may seem like there should be a public policy and intervention, there really isn't due to the existence of health insurance treatment. As you know, it's considered a mental health disorder, and so it has been given health insurance coverage. So anyways, this policy is going to address training individuals to detect signs and refer people to treatment for their specific eating disorders. And it's a hierarchical system, so a clinical expert teaches a non-expert who teaches an undergraduate student who tells their friends and their peers. So the specific study is an evidence-based mental health intervention called the Body Project, and it's a peer-led program designed to reduce eating disorder factors. It's a 2-day program where individuals are taught and then they are able to counter the social pressure to be thin. It addresses a lack of clinicians in terms of time availability and expensive cost. So in the specific study, the hypothesis was that participants would experience significant reductions in eating disorder risk factors after involvement in the Body Project. For the study methods, data was collected from March 2009 to spring 2010 among 64 consenting undergraduate members of a sorority. And what they did was the individuals who conducted the study created questionnaires with scaled measures for each of the dependent variables, which were body dissatisfaction, thin ideal internalization, which is basically a way at looking at how society and social media influence how you view yourself, negative affects on emotions, and eating disorder pathology, which is basically the actual behavior of having an eating disorder. So whether that is something related to your anorexia or bulimia, that's what that would be. And these were measured at the baseline when participants joined the study, post-treatment, and 5 months later, and the study was looking for changes in their answers. And 3 statistical methods were used, and they conducted linear regressions. So what the results were that they found significant decreases in thin ideal internalization, eating disorder pathology, and body dissatisfaction, but not in negative emotional affects. They found a larger decrease in these negative symptoms, or these negative dependent variables, than they did in previous versions of this study. One of the limitations to this study is that there was a high participant dropout rate and a small sample size, so future studies could be conducted with a bigger sample to really see the true effects of these policies. So how does this address eating disorders among young people? It shows that training individuals in evidence-based care or in evidence-based interventions for mental health conditions is effective. It's essentially a way to screen individuals and prevent other further risks and externalities. It also shows that when public policies are not in place to solve the problem, other interventions at a smaller level are possible. And policy could be adapted to meet the needs of K-12 schools, not just universities in the future. And that's all.